Alpha-1 antitrypsin deficiency is a serious chronic health problem. Up to 3% of COPD patients in the U.S. have AAT deficiency. Genetic screening is the only definitive diagnostic test for AAT deficiency.
If we start screening in our COPD population, it's almost certain that we will find those patients. The time point when you actually diagnose the disease decides when you are able to start therapy. We tend to think that it's only a good result if we detect someone who suffers from severe deficiency. But it's also very important to exclude the carrier status or to exclude the disease in COPD patients. So that should actually give us a good feeling if we have done that and we have excluded the disease.
I know now as an expert in alpha-1 antitrypsin, it's not really rare, it's rarely thought of or rarely tested. So it's extremely important to test not only the young, but the old patients for alpha-1, because let's say we find an 80-year-old with alpha-1 antitrypsin deficiency. That may lead us to do family testing. We may end up finding a younger grandchild that has alpha-1 carrier state or maybe severe deficiency and prevent them from smoking early on. When I find that genotype or abnormality in the patient, I feel like I've gone that extra step.
It's important to screen them because you're not going to find them any other way. The only way to know is by screening. You know, they look the same, they smell the same, they walk the same, they cough the same, they have all the same symptoms as your other COPD patients. The only way to know is screening. Every time I find one, it is a aha moment, you know, that we found them and they wouldn't have been found any other way without that screening protocol that we have in place. And had I not listened to Carol, had I not listened to a few other patients, I definitely would have missed some important nuggets of information to help find their diagnosis. She was sicker than everybody was telling her. That she now had a reason to feel the way she felt. You know, that changed it from being out of control with this disease to now I know what it is and now I'm gonna tackle it.
I felt vindicated.
Yeah.
I was really, really sick. And it was like no one knew how sick I was. And I was gonna do something about it.
It's important to test a patient with COPD for alpha-1 because it's a guideline. The guidelines suggest that all patients with emphysema should be checked at least one time in their life for alpha-1 antitrypsin.